Hey guys, have you ever wondered what the heck is included in the NCLEX? Did you know that there's a handy test plan with a pie chart that breaks down the categories of what you'll be tested over on the NCLEX? Are you guys ready to go? Let's get started. Hi, my name is Marie. I've been working as a nurse for over a decade as a telemetry and a medical surgical nurse, and in addition to working at the hospital, I also write NCLEX-style questions here at NRSNG. Along with this job comes an appreciation for the NCLEX. Maybe even an obsession? Okay, if the NCLEX could issue a restraining order, it would hand one to me. I am always going to the NCLEX plan, and I'm looking through it, and I'm making sure that we are following the NCLEX plan when we write our questions for you guys to practice. Today, we're going to talk about physiological adaptation. So the physiological adaptation portion of the NCLEX is 14% of the test, give or take a percentage. So what exactly does the test plan say about this section of the test? I have broken down the wordy explanation on the test plan into 5 main points. Okay, number 1, fluid and electrolyte imbalances, to identify signs and symptoms of these imbalances. Number 2, alterations in body systems. We're going to talk about what that means exactly because they're very specific on the test plan about what you need to know. Number 3, pathophysiology. Number 4, hemodynamics. And number 5, illness management and unexpected response to treatments. Okay guys, this is going to be a 2-part video, and today we're going to focus on the most important part of physiological adaptation, and that is fluid and electrolytes. There are 4 main fluid and electrolytes that you need to know for the NCLEX. You also need to know what causes imbalances, and finally, signs and symptoms of imbalanced electrolytes. Let's briefly review what causes imbalanced electrolytes. Here you can see on the chart we have organ failure, and specifically renal failure, and then cardiovascular failure. We have illness, which comes from infections, diabetic ketoacidosis, and diarrhea. We have medications, which there's plenty of medications that cause electrolyte imbalances. And then there's diet. So diet also causes imbalances in your 4 main electrolytes, as well as others. Here are the 4 main electrolytes that I want you guys to know: potassium, sodium, magnesium, and calcium. Let's start with potassium. All right, guys, what are some of the things that cause imbalances in your potassium level? The main organ that is responsible for potassium imbalances is your kidneys. So if those fail, then you're going to have an imbalance in potassium in your body. Illnesses can cause potassium imbalances as well, specifically Cushing's syndrome, vomiting, diarrhea, and Addison's disease. Medications can also cause imbalances in potassium. We have diuretics as the main culprit, and then corticosteroids as well. Finally, diet, of course, would affect your potassium level. You can either be taking in too little or too much potassium, and of course, that's going to affect the level in your blood. All right, guys, so what is potassium responsible for? Potassium is responsible for cardiac conduction. It lives inside the cells mostly, and it goes outside the cells when the cardiac muscle contracts. Potassium is also responsible for skeletal muscle contraction, as well as the body's acid-base balance. So the normal potassium level is between 3.5 and 5 milliequivalents per liter. Here are some signs and symptoms of a low potassium level. This is called hypokalemia. The patient will have a weak and irregular pulse, weak respirations, weak skeletal muscles, and decreased GI motility. And here's what happens when there's too much potassium in the body. Again, a patient will have a weak and irregular pulse, but they will have muscle twitching, cramps, and increased GI motility. Okay guys, we covered potassium. Now we're going to move on to sodium imbalances. So when you think of sodium imbalances in the body, you'll also want to think of fluid volume imbalances, because if you go all the way back to your pathophysiology courses, you'll remember that water goes where salt is. If there's too much or too little sodium in the body, there's also going to be an imbalance of fluid. Okay, some of the organs that are responsible for sodium balance in the body are your heart and your kidney. So if these 2 organs fail, or if either one of these organs fail, you are going to have a sodium imbalance. Some illnesses that cause imbalances of sodium in the body are syndrome of inappropriate antidiuretic hormone, or SIADH, Cushing's, vomiting or diarrhea, and wound drainage. Some of the medications that cause a sodium imbalance include diuretics and corticosteroids. And finally, diet. Again, like potassium, with a diet, if you are taking in too much or too little sodium, it is going to affect the amount that is available in your body. All right, the normal level of sodium in the body is between 135 and 145 milliequivalents per liter. So what is sodium responsible for? We have nerve impulses, muscle contraction, cardiac conduction, where in its natural form, the sodium lives outside the cells. When the sodium travels inside the cells, this is cardiac contraction. And again, sodium is responsible for fluid shifts inside and out of the cells. Okay, what happens when there's not enough sodium in the body? The patient is hyponatremic, and they will have a rapid pulse, thready or bounding depending on their fluid status. They're going to have weak respirations. They're going to have skeletal muscle weakness, diminished deep tendon reflexes, confusion, headache, and increased GI motility. So hyponatremia causes increased GI motility. If a patient is hypernatremic or has too much sodium, you're going to find that they have muscle twitches, altered cerebral function, agitation, and dry, hot, flushed skin. Okay, so we've covered potassium and sodium. We're going to move on to magnesium. Some of the main organs that are responsible for magnesium balance in the body are the liver and the kidneys. So you can imagine that if these two organs fail, then you are going to have imbalances in your magnesium level. The main illnesses that cause imbalances in magnesium are celiac disease, Crohn's, vomiting, and diarrhea. There are a few medications that cause magnesium imbalances. The main ones are diuretics, insulin, and antacids. Finally, if a person is malnourished or they're an alcoholic, which leads to malnourishment, they're going to have a low magnesium level. All right, you guys, a normal magnesium level is between 1.6 and 2.6 milligrams per deciliter. So what does magnesium do in the body? There's a few things. Again, going back to your anatomy and physiology, magnesium is partially responsible for ATP formation, cell growth, skeletal muscle contraction, and carbohydrate metabolism. What are we going to see in a patient who has hypomagnesemia? It's hard to say. It's a mouthful. We're going to see tachycardia, hypertension, shallow respirations, muscle twitching, tetany, and irritability. So that's hypomagnesemia. And what are we going to see when the patient has too much magnesium in their body, or hypermagnesemia? We're going to see bradycardia, hypotension, diminished deep tendon reflexes, skeletal muscle weakness, and the patient will be drowsy. All right, you guys, there's one more electrolyte that we're going to cover today, and that is calcium. So some of the organs that are responsible for balancing out calcium in your body is the kidneys and the pancreas. As you can imagine, if these organs fail, you are going to have imbalanced calcium levels. A few illnesses you may see in your patients that lead to calcium imbalances include any illness regarding the parathyroid or adrenal glands, any malignancies, and diarrhea. Some main medications that can affect calcium levels are thiazide diuretics, glucocorticoids, and lithium. Again, like with the other electrolytes, in your diet, if you're taking in too much calcium or not getting enough, you're going to see that it follows that your calcium levels will be higher or lower. In addition, vitamin D intake affects your calcium level. So if you're not getting enough vitamin D, your calcium level will actually be lower. The normal range of calcium is between 8.4 and 10.2 milligrams per deciliter. You are going to see calcium levels closely linked to the parathyroid gland. Calcium is also responsible for nerve and muscle contractions and coagulation. So what are we going to see in the patient with hypocalcemia? We're going to see a decreased heart rate, hypotension, diminished pulses, twitching, cramps, and a hyperactive deep tendon reflex, numbness in their face, and increased gastric motility. What we're going to find in a patient with hypercalcemia is exactly the opposite of a patient with hypocalcemia. We're going to see an increased heart rate, hypertension, and bounding pulses. We're also going to see skeletal muscle weakness, diminished deep tendon reflexes, and decreased GI motility. That's it. I hope this helps take the stress out of nursing school. If you would like to learn more about the 4 electrolyte imbalances and physiological adaptation, head on over to NRSNG.com and sign up for a trial. Stop struggling through nursing school alone. We are here to help. Thanks for spending time with me today, and as always, happy nursing.